Hi, Dr. Dana here at Steinway Family Dental Center. We get a lot of questions about dental hygiene, dental cleaning. Today we're going to answer some of those most common questions that we got. The first question is, what is proper dental hygiene? Well, it is somebody who is actually going to do dental hygiene at home, right? So you would be flossing, brushing your teeth. The question is, how long should it take? The brushing should take about 2 minutes, 1 minute on the top, 1 minute on the bottom. We're talking about people who are healthy otherwise, right? If you do have gum disease and the gums are bleeding and so on, then of course it should take longer than that, not shorter. That is what you can do at home yourself, but you also should be properly taken care of by a dental hygienist who is going to help you to keep your work at home easier, right? Because regardless whether you brush your teeth or not, you will at some point start developing tartar inside or biofilm. So if you don't remove it everywhere on time, it will become a little harder. So you need dental hygienists to help you and remove everything from your teeth. And she would help you to understand what are areas in your particular mouth that needed a little more attention. The next question is, what can happen if I don't practice good oral hygiene? Well, number one, of course, you're keeping bacteria in your mouth, right? And if normal person, let's say, has this much bacteria in their body, you have that much. Why? Because now they're flourishing. The mouth is warm, moist, and we put food in there for bacteria. So bacteria is like ancient Rome for them parties every day, right? So you want to get rid of that, because through the mouth there is blood streams that come here through your blood vessels, and bacteria can enter it and travel through your entire body. By the way, the first stop when bacteria enters your blood vessels is what? Your heart. So they can do a lot of damage there. Now you want to get rid of all the bacteria there, and hygienists can help you with that. The next question is, what are the main duties of dental hygienist? How would she help you? Well, basically they would help you by getting the x-rays, pictures, and scan together. They are the first ones who are going to do the cleaning for you. And while they're doing the cleaning, they can actually see what habits you have that are helpful and where are you deficient, because they can see what's not being cleaned properly or as well as it should be. And they can address it and advise you how to behave better, so they can change your behavior in that sense. Of course, not without you, but they can help you to change your behavior for the better. Next question is, what is involved in a dental cleaning? Well, it involves a patient and the hygienist, right? Somebody's going to help you and clean your mouth. Now, but it doesn't happen without you. A lot of time, patients are scared and they don't want to go to the dentist, especially because they're embarrassed because they haven't had a dental cleaning or proper hygiene visits in a while. Don't be, because all you need is the first step. Come in, we have seen it all, don't worry, you're not going to be embarrassed, or don't be embarrassed. Come in and we're going to help you out. This is the first step. From there on, your entire life is going to get better. Next question is, what kind of tools dental hygienists use? Well, there's a different category of tools. They can use tools that are hand tools, which means they just hold it in their hand and they scrape the teeth. It's usually used for hardened biofilm, right? Or like the calculus, we call it. So to remove that, right, something that's stuck to your teeth, they can use that. There's another one that is vibrating electric instrument that they're going to use, and they move it around the teeth. It usually comes with the water spraying on your tooth to clean it up. So it's kind of like a power wash with the tool that vibrates. And the third tool they use is it's a polishing cup that has a special paste, and they would polish your teeth at the end of that. Of course, after that, they can use a fluoride treatment, and that will make your teeth less soluble and less susceptible to decay. Next question, does hygienist teeth cleaning usually hurt? The truth is, it doesn't hurt, or it doesn't have to hurt. When it's done properly, it is not painful at all. Some people are more sensitive to the temperature because it's also sprays cold water, and if that is the case, they can always use something to help you out with that. There's a gel that they can just place around your teeth, and that will help. For some patients who are really afraid and they don't want to feel anything, yes, of course, if they could get injections so they don't feel anything. Next question is, how long typical dental cleaning should take? Well, the cleaning itself, without really like x-rays and so on, should be about 20 minutes. Can it be taken longer? Yes, it depends on how much cleaning they actually have to do. So it depends on what they have to do there. But between 20 minutes and an hour, it should be over. Next question about deep cleaning. Why would it be necessary? Well, as you know, the space between the gum, where you see the gum connects to the tooth, that's not really where it connects, because it looks like this. So there is a space in here that's called a pocket. And sometimes those pockets are measured, and depending on how big they are, the cleaning could be needed just where you see the gum connects to the tooth, or going inside. Once you go inside, it's a deeper cleaning.